Hello, my name is John Catanzaro and I specialize in physical therapy and a new type of electronic acupuncture that is completely non-invasive. What you are about to see is a 90-year-old male whose pacemaker is being monitored by a prominent cardiologist, Dr. Nathan Siegel of the Mount Sinai Hospital in Miami, Florida. I'll be performing 3 procedures. The first 2 scenes will be to release or repolarize the scar tissue on the left hip and the right knee. Mendel had hip and knee replacement surgery several years ago and has been experiencing heat, pain, and tightness when he walks. The third will be to strengthen his kidneys and tone down his bladder because he's been urinating 5 to 8 times a night for many months. He's been taking several different drugs to alleviate this condition with some side effects. I feel I can help this matter in as little as 1 to 2 treatments without the use of drugs. So initially what I want to do is, there's a scar tissue that Mendel had over here on his hip.
Yes.
And basically what I want to do is just do a quick release on the scar tissue.
Very good, yes.
So,
now remember the, let me see.
Yeah, I want you to feel what that scar tissue is like. And the reason I'm having you feel that is because these units release scar tissue on hip replacements, knee replacements, and everything, breast augmentation, the whole 9 yards.
Okay.
After we release this, generally my patients, 90% of them have a lot more fluid movements.
Tell us when you're ready.
Good.
Go ahead and start.
Okay.
Start. And you can do, John, whatever you want to. I'm watching. Keep going. That's what I want to see. Okay, we're all right here. Stop.
Yeah.
We're okay. It didn't alter the PRO. Now don't, you just leave that on there. I want to do the one nearer. But so far it's excellent.
Yeah.
I want to be able to. Okay, perfect. No change on the cardiac. Excellent. What a wonderful patient.
Okay, so
wonderful. Okay.
if you want to feel this, and you can feel the difference in the scar tissue.
I can't even feel the scar tissue anymore.
Yeah.
That's a miracle.
And that's only 1.
That is unbelievable.
Is that amazing?
That is amazing. I mean amazing from the scar.
Okay. There. With my units, I can tonify or sedate.
Pre and
That's
post
exactly what I want.
tense on the scar tissue of the
Pain?
left
Pain.
Yeah.
iliac air crest area.
What has this to do with the kid?
No, this is very interesting.
Yeah. What is that? I'll show you. Hopefully
Very
tonight.
good question.
Left iliac
Hopefully.
crest.
Okay, so what I've done is I've tonified the kidneys.
Okay.
Now I want to sedate the spleen.
Sedate
The spleen.
the spleen. Okay.
Spleen 6.
Very interesting.
It's
Hey.
very interesting.
You
Fascinating.
can hear this is going up.
Yeah.
A lot of pain.
And then
Okay, there.
do one quick one.
And then you can relax. Mendel's been a patient of mine now since January. I've been working on him a lot with balance issues, and just recently, which was Friday, I had him with Dr. Siegel here, who ran an EKG because of his pacemaker. And obviously earlier in the video we saw that we did some work on his left hip scar tissue here. I did work, which we can't see, but we did work on his bladder and kidney issue because Mendel was using the restroom 5 to 8 times a night.
Mm-hmm.
How long have you been doing that?
I was doing that for months and months, and I get a lot of painkillers for that.
Yeah.
It never was helping. But since John put on this acupuncture with me, electronic, I had improved enormously.
Good.
I'm going to the bath twice a night only.
Yeah, twice a night.
Twice a night.
And what I also
During the day I'm going normal because I'm also not drinking more.
exactly, yeah, you got to drink more. So also what I didn't show on the video was I also worked on his wife, Cecilia.
Correct.
She had been going to the bathroom 3 to 5 times a night. Now she's going to the bathroom once,
Which I can confirm that.
which Mendel will confirm that. Dr. Siegel was very pleased with the results. Number one, the results, the fact that the everything that I did with the electrical acupuncture absolutely did nothing to irritate the pacemaker. That was our first and foremost issue. The second issue was the scar tissue. The scar tissue on Mendel's left hip and right knee. When I had done the scar tissue on Mendel's left knee, also you felt more fluid, more movement.
More movement.
Less tight.
Less tight. It was tight, of course, Dr. Umlaut made it with a bigger size, which I really needed, and this stretched a little bit, and John was so kind and did it.
Right.
And it's helping a
Right.
lot.
Did a little of the acupuncture. I did that Friday, and that reduced the pain.
That reduced the pain from 100, if you say, from 10 to 4.
Right. So it was 100% pain, and then after the pain, it went down to about 60% less pain.
Less pain.
And
Today,
well, I worked on the teeth also yesterday, as well as the right knee. And after the right knee, we had a lot more movement in the knee. And then again on Mendel's bottom jaw, we worked on that, and then instead of 60%, we had 70%. So far, everything that we've been doing,
everything was doing, it was successful, and I'm happy, and hopefully it doesn't come back. This is no guarantee.
exactly. And if it does come back, then
Then John will take care.
Then we'll take care of it. And also the EKG shows the fact that it has absolutely no bearings on a pacemaker, which is the primary reason for this whole video.
The primary reason Dr. Siegel came to convince himself that John is the man which can operate a lot of things, helping people a lot.
I'm the man with a plan. Thank you. By using electronic acupuncture, there is no negative effects on this patient's pacemaker.